So guys, let's quickly look at the pre-analytical factors that may affect what result quality control. All right, and this is just trying to talk about the laboratory, how results are being gotten in the laboratory, okay, and to what extent are these results actually accurate, okay. So this question was actually asked in an exam. It said I should briefly discuss pre-analytical factors that affect what result quality control. All right. So briefly discuss them. Right. So you could see some of the pre-analytical factors like the transportation, the timing of collecting the samples. All right. The storage of the samples, the way in which you process the samples. All right. The types of containers you use to store the samples. This is where you're having wrong anticoagulants. Right. You can use a wrong anticoagulant for a wrong assay. All right, then sampling too. That's basically how you collected the sample, in what position was the patient. Do you understand? What was the size of the needle you used? All right, and all that. Then also the patient environment too. Right? So now let's look at these pre-analytical factors. All right. So these pre-analytical factors which may affect the qualities of results prior to their analysis can either be um, the ones that I can control, those are the controllable ones, or the ones that are what non-controllable, right? So for the controllable ones now, let's move through them. You have factors like what specimen collection, all right? How was the specimen collected? And all this is collected, is controlled because you can do it better. Do you understand? Then also physiological variables such as what postures, okay? So when you are standing up, albumin concentration or albumin levels can be varied, okay. Then exercise and physical training exercise physical training can basically increase creatine kinase. All right, then you have circadian variation is seen in what iron and corticosteroids, and menstrual cycle will also what affect hormone changes. Of course, you have a lot of hormones going up, skyrocketing during what menstruation. Then we have what lifestyle changes. All right, basically just lifestyle. All right, is the person out abusing alcohol? Do they smoke? All right, and all those stuff. Then drug intake can also affect what quality of results. Okay, diets. For this drug intake, it could be that you took in some drug that for that time being they basically elevated some analytes in your body like calcium, sodium, and stuff, right? So if you come to measure them, you might have a false increment, or you could take some drugs that are basically suppressing. Okay, then diets too. That's when you are carrying out tests like what fasting blood sugar immediately after eating, when you are supposed to carry out fasting blood sugar only when the patient has not eaten in the last 8 hours. Do you understand? Then traveling too, we said that hemoglobin tends to what increase with changes in altitude of different regions or areas. All right. So now that's what the controllable factors. Let's look at what non-controllable factors. For the non-controllable, we said that what these variables cannot be controlled and they affect results. Okay, so they are grouped into two. We have the biological factors and we have the environmental factors. For the biological factors now, we have things like age. So for example, alkaline phosphatase is increasing in children, and we have bilirubin is increasing in neonates. That's normal, right? And that's not controllable by you. Okay, then sex. Of course, testosterone is more in men and estrogen is more in females, all right? Then race now. We say that interpreting results, the issue of race should be put in consideration because creatine kinase is normally higher in blacks, all right? Which at such concentration will be inappropriate for what? Races like the Americans, the Indians, the Asians, and the rest of them. Then underlying medical condition. Conditions like obesity, blindness, pregnancy. Pregnancy will normally what? Elevate glucose and hormones. Stress levels will elevate what? Cortisol, right? Fever, shock, trauma, transfusion and infusions. All these will affect what? Sodium, chlorine, or glucose levels in the body. right? So, talking about lastly the environmental factors that may influence laboratory results. We have things like what altitude, okay? So hemoglobin will normally what increase in higher altitudes, all right? Ambient temperature, geographic location, and seasonal influences. All right. So about 70% of laboratory errors are pre-analytical. All right. And a higher percentage of this is as a result of what? Poor sample collection, transport processing, storage, and patient preparation. Okay. So now clinical useful results are highly dependent on the patient preparation and pre-analytical discipline. All right. So thus now clinicians and laboratory workers are to understand the importance and impact of these factors if results are to be accurate at all. All right, that's it about what the pre-analytical factors that affect what result quality control in the laboratory. So that's it, guys, and bye for now.